So my name's Emily, and I'm a second-year medical student at UC, and my pronouns are she, hers.
I'm Simia, and my pronouns are she, her, hers, and I'm a first year med sci major at UC. Or I guess we're all at UC.
I'm Brooke. I'm a second year med sci major, and my pronouns are she, hers.
I'm Anish. I'm sure I've met you somewhere, Emily. My pronouns are he, his, him. I'm a third year UC. So, yeah.
Wait, are we all med sci majors? Or were med sci majors at one point?
Yeah, I think, yeah.
Okay, cool. Are you all interested in like becoming clinicians, or are you interested in like a non-clinical career?
I'm clinical.
Yeah, me too.
Clinical as well here.
Okay, cool. So are you all more interested in learning like about how providers are taught to like talk about sexual health, or do you want to talk more about like how you as like a patient can approach a visit with your physician about your like sexual health? Or both, or neither.
Okay, this might not have anything to do with your slides because I did watch your like earlier presentation, but I have a general question to ask.
Yeah.
So I took the HIV course with Jason Blackard, and he kind of introduced the idea that there's like the ratio of individuals in the US who have like STIs or HIV is significantly prevalent now. So do you think it would be like kind of offensive to have HIV screening for you and your partner before you kind of engage in sexual activity?
No, because whatever you want to do with your body is your right. And if your partner or potential partner is like really uncomfortable with that, then sucks to be them, I guess. No, I don't think it's like unreasonable at all. I think like technically you should get like, if you don't have like a consistent like monogamous relationship with one partner, like you should like technically get tested regularly for STIs. So no, that's like not unreasonable at all.
Okay, cool. Because I get into debates with people all the time, and I always think like it's not that much of a reach to ask people to get tested. But I don't know. Yeah.
I think people just associate like having an STI or like having a history of getting STIs as like shameful. And, you know, it's really not. It's, of course, like some STIs like HIV can have a very significant impact on your life, which is something to consider. But if you like had chlamydia or gonorrhea, like even several times, it's not really a big deal. It's basically like getting an ear infection or getting strep, you know? It's just like a medical thing. And so I don't know. I think that's why people are like taken aback or uncomfortable, because you would assume it's almost like you're assuming that they're like irresponsible people, and you know that's not how it is.
For sure, yeah. I feel like for people who like say they don't want to get tested because they don't want to find out, I feel like that doesn't objectively change anything. I mean, if you have like, chlamydia or gonorrhea, it's not like you not getting tested is going to change that. In fact, it would probably just make safe sex practices like just harder to do in general.
Yeah, is more knowledge better. But I mean, in my opinion, if it's something that can be like very easily treated, especially like chlamydia and gonorrhea, that's like not something that you should be scared to know about. Like if you, I don't know, like if you had like white, like white stuff in the back of your throat, wouldn't you want to know like what it is? Like if it's like fungal or bacterial or whatever. I don't know. It's fixable. Okay, I will share my screen. And I guess like since we're kind of all interested in like clinical stuff, and this is like stemming off of our conversation a little bit, I'll kind of go into like how we learn how to take a sexual history as clinicians. So we're like taught in medical school how to talk about like each organ system, like what questions to ask to like, you know, diagnose somebody, figure out like what is going on, or what their like normal is. And so this isn't like, these questions aren't necessarily like the whole sexual history. It really like depends person to person what they're coming into the doctor for, like what you can ask them. But I think some of these questions that I listed here are ones that tend to be forgotten about that are really important to discuss with your physician. So I guess one that like relates to our previous conversation is, what kinds of sex do you have? So especially if you're concerned about STIs, like it's important to know like which parts of your body you're using to engage in like intimate acts with, so that like physicians can, you know, if you're concerned about STIs, can test the right places, test the right holes. And then besides that, like asking about how you have sex with others or how you have sex with yourself. So intimacy is not something that we only engage in with other people. You can be like intimate with yourself. And that's something that, you know, the majority of people do engage with. And so like that's like a big part of your sexual health and sexual life that, you know, you can discuss with your physician, that you shouldn't be afraid to discuss with your physician. Something else that, let's see, what other questions do I have in here? Okay, so if you're interested in like becoming a clinician, I think like thinking about the ways that you ask questions is really important. So one of the questions I had is like, what drugs do you like to use? That's like a much less stigmatizing way to ask, like, what illicit are you using? Or do you take any drugs illegally? You like, as a provider, your goal is to make the environment with you and your patient like the most open, honest, trustworthy environment that you can. And so I think, especially around reproductive health, it's really important to think about how we're asking these kinds of questions. Let's see, what else can we talk about? Okay, and then if you're not interested in becoming a clinician, maybe you're interested in like public health or policy making. Something that I would recommend is a book called The Zero Trimester by Miranda Wagner. And in that book, she talks about how, you know, you might be familiar with the fact that you have to take like prenatal vitamins if you find out you're pregnant, and if you don't, your fetus can have neural tube defects. And the reason why that the reason why tube defects aren't so common anymore is because we fortify our products with folic acid. However, the FDA made that decision basically with only white people in mind, because white people primarily eat wheat products. But if you primarily eat rice, or you primarily eat corn products like, you know, corn tortillas, masa, whatever, you're not getting that fortification or supplementation that the FDA wants you to have, or maybe doesn't want you to have. I guess that's like a controversial thing. So if you're like not interested in like being in a room with a patient, there's still like a lot of ways you can engage with people's reproductive health and autonomy that are still like really important. So I just wanted to like include that fact as well. And even if you're a clinician, you know, engaging in advocacy, I think is really important. Any other questions or comments? You don't have to have any. Or even about MedSci. That is okay if you don't have any. I will probably hop to my next breakout room, but it was lovely meeting you all, and I'll see you in the big session.
Thank you.
Thank you.
Of course.